Welcome back for another deep dive into the latest healthcare happenings.
Should be a good one.
Always is. We've got a lot to unpack today, from AI making headlines
Oh,
to
yeah.
some political curveballs.
Definitely some surprises there.
Let's kick things off with the Wall Street Journal. They're all over this AI breakthrough coming out of China.
That's right. DeepSeek just dropped their R1 model.
The R1.
Yeah, and it's making some serious waves.
What's so special about it?
Well, for starters, it claims to be just as powerful as the competition.
Okay.
It uses way fewer resources.
So that's why NVIDIA's stock is in free fall.
Exactly. Their market cap has taken an $800 billion hit.
Ouch, $800 billion.
Yeah, it's a big deal. And there's this whole whisper campaign going around
What about?
that DeepSeek might be using tech that's awfully similar to OpenAI.
Interesting. OpenAI is the company looking for that massive $40 billion funding, right?
That's the one. They're aiming for a $300 billion valuation.
Wow. So basically a David and Goliath situation in the AI world.
You could say that. Some analysts are even suggesting DeepSeek used a technique called distillation to create the R1.
Distillation. What's that?
It's kind of like, you know how you can condense a whole textbook into a few key pages?
Yeah.
Distillation does something similar with AI. It trains a smaller model to perform like a bigger one.
Huh. So could this mean cheaper, more accessible AI in the future?
Possibly. But it also raises questions about intellectual property and how these innovations are developed.
Good point. It's not just the tech world buzzing about AI, though. Healthcare is ripe for disruption, too.
Oh, absolutely. AI could change everything, from how we diagnose diseases
To how we treat them.
to even discovering new drugs.
I read somewhere that AI could even help with doctor burnout.
It's true. Imagine virtual health assistants available 24/7.
Always there to lend a hand.
Exactly. They could take over routine tasks, provide support for complex decisions,
Giving doctors a much-needed break.
and improving patient care in the process.
It's amazing to think about the possibilities. But all this hinges on one thing, data.
Data is the lifeblood of AI. We need massive amounts of it to train these algorithms.
But that raises privacy concerns, right?
Absolutely. How do we ensure patient data is protected while still allowing AI to learn? That's the million-dollar question.
Speaking of big players, let's talk about Amazon. They're making a serious push into healthcare.
Way beyond just selling medical supplies.
Yeah, they're partnering with companies like Teladoc
The telehealth giant.
and mental health providers to offer a whole suite of services.
Virtual care, chronic disease management, you name it.
So they want to be the one-stop shop for all your healthcare needs.
Basically. And this puts them head-to-head with Walmart, who's also been expanding their healthcare offerings.
Looks like the battle for the future of healthcare is heating up.
No doubt about it. And speaking of battles, the political arena is throwing some punches too.
The Trump administration is back, and they're not wasting any time making an impact.
Their biggest move so far has been nominating Robert F. Kennedy Jr. for HHS Secretary.
That sparked a lot of controversy,
It has. His confirmation hearings have been pretty dramatic.
mostly due to his views on vaccines,
He's been very vocal about his skepticism, even promoting some debunked theories.
which has caused a lot of pushback from the medical community.
Rightfully so. They see him as a threat to public health.
His stance on vaccines has become a flashpoint,
It's really a debate about the role of science in policy.
and whether personal beliefs should influence public health decisions.
Exactly. And then there's the issue of Medicare.
Didn't he stumble a bit during his hearings on that?
He seemed to lack a deep understanding of how the program works.
Which raised concerns about his ability to manage such a complex system.
That's a lot of responsibility.
It is. And, on top of all that, there are concerns about the administration's stance on other healthcare issues.
Things like family planning and transgender rights.
Articles are popping up everywhere, highlighting anxiety over potential rollbacks.
The administration already issued an executive order restricting gender-affirming care for trans youth.
Which has sparked outrage among LGBTQ advocates.
They see it as a direct attack on trans youth.
And it's likely to face legal challenges.
Oh, absolutely. This is just the beginning of a long fight over healthcare access and individual rights.
And amidst all this political drama, a tragedy shook the healthcare industry.
The murder of United Healthcare CEO Brian Thompson.
Such a shocking event.
It really sent shockwaves through the industry.
And brought to light the frustration many Americans feel towards the healthcare system.
Rising costs.
Limited coverage options.
A system that often feels bureaucratic and uncaring.
Thompson's death, while a horrific act of violence, has become a symbol of that broken system.
And the anger many feel towards those who profit from it.
It's a stark reminder of the human cost of healthcare.
And the urgent need for change. It's a tragedy that shouldn't be forgotten.
Absolutely.
Yeah.
We need to keep pushing for a more just and equitable system.
Agreed. And while there's a lot of work to be done, there are some glimmers of hope.
Oh, like what?
Well, there's this new framework for digital health education that's making waves.
What's that all about?
It's basically recognizing that doctors need training not just in medicine, but also in technology.
Makes sense. The future of healthcare is digital.
Exactly. Future physicians need to be comfortable with AI tools, data interpretation, all that.
So it's like a 21st century medical school curriculum.
Precisely. It's preparing them for a world where technology is at the forefront of patient care.
That's encouraging.
Mhm.
And speaking of technology, let's circle back to AI's potential in healthcare.
It's not all doom and gloom.
Definitely not.
Yeah.
There are so many ways it can improve patient care,
One area where we're already seeing progress is in streamlining administrative tasks.
like we talk about with Zoom and Suki.
Right. AI can help with things like scheduling appointments, documenting patient interactions, even pre-authorizing treatments.
Taking a load off doctors' shoulders.
Exactly. And freeing up more time for them to focus on patients.
Sounds like a win-win.
It has the potential to be. But we need to be mindful of the ethical implications.
That's key. AI is a tool, and like any tool, it can be used for good or bad,
We need to ensure it's developed and implemented ethically.
with patient privacy and safety top of mind.
Absolutely. Speaking of ethical considerations, let's shift gears and talk about the financial side of healthcare.
Always a hot topic.
It is. Healthcare costs are a major concern for so many Americans.
Drug prices, surprise medical bills, insurance
Yeah.
battles.
Right.
It's a lot to navigate.
One of the biggest challenges is the lack of transparency in pricing.
You mean not knowing how much something will cost until you get the bill?
Exactly. It makes it impossible to budget and plan.
There's been some talk about price transparency laws.
There has. But the industry is pushing back.
Why is that?
They argue it's more complicated than it seems and could actually lead to higher costs for some patients.
Sounds like a classic case of competing interests.
It is. Finding a balance between empowering patients and ensuring the financial stability of the system is tough.
And then there's the issue of rising drug prices.
Pharmaceutical companies have been hiking prices like crazy.
It's putting a huge strain on patients and insurers.
There's been talk about allowing Medicare to negotiate drug prices.
Or importing medications from other countries where they're cheaper.
But progress has been slow. The pharmaceutical lobby is very powerful.
It's a tough battle to fight.
It is. Finding a way to incentivize innovation while ensuring access to life-saving medications is a delicate balance.
And then there's the whole issue of surprise medical bills.
Oh, yeah. Those are a nightmare.
Getting hit with a huge bill for something you didn't even know wasn't covered.
It's a betrayal of trust and a financial burden.
There's been some bipartisan support for legislation to protect patients from that.
There has, but the healthcare industry is complex.
So many stakeholders with different agendas.
Exactly. Finding a solution that works for everyone is a challenge.
But the public outcry is growing, so hopefully that will push things forward.
It might. Despite all these financial hurdles, there's also a growing movement towards prevention and wellness.
Shifting the focus from treating illness to preventing it.
Exactly. It's a recognition that true health goes beyond just fixing what's broken.
We need to address the root causes of well-being,
We're seeing more interest in personalized medicine
tailoring treatments to individual patients,
and integrating mental health care into primary care settings.
taking a more holistic approach.
It's about addressing the whole person, not just their symptoms.
And the telehealth revolution is contributing to this shift as well,
Virtual visits are making it easier for people to access care.
especially those with chronic conditions or limited mobility.
Telehealth has the potential to transform healthcare delivery, making it more convenient and affordable,
And it empowers patients to take a more active role in their own health.
which is so important. And then there's value-based care.
That's the model that rewards providers for keeping patients healthy.
Exactly. It's a move away from the fee-for-service model, which incentivizes unnecessary tests and procedures.
So instead of quantity, it's about quality.
That's the idea. Rewarding providers for keeping their patients well.
Sounds promising, but is it actually working?
It's still early days. There are definitely challenges.
What kind of challenges?
It requires a high level of coordination between payers and providers and a cultural shift within the healthcare system.
Moving away from a reactive approach to a proactive one.
Exactly. It's a complex transition.
But if it works, it could be revolutionary.
It could. It aligns the incentives of providers with the best interests of patients.
Encouraging collaboration and prevention.
Exactly.
It's a lot to take in.
It is. The healthcare landscape is constantly shifting.
But that's what makes it so fascinating.
Absolutely. There's always something new to learn.
Speaking of new developments, there's another important piece of the puzzle we need to discuss. The social determinants of health.
Ah, yes. Those are the factors that influence health beyond traditional medical care.
Things like poverty, access to education, safe housing.
Even transportation. All these things can have a huge impact on a person's well-being.
It's a reminder that health isn't just about individual choices. It's deeply connected to the environment and circumstances people live in.
We're seeing more and more research highlighting how these social determinants contribute to health disparities.
The unequal distribution of health risks and outcomes.
Exactly. It's not enough to just provide access to health care. We need to address the root causes of health inequities.
And that requires a much broader approach.
Absolutely. It's not just about healthcare providers. It involves policymakers, community organizations, and individuals themselves.
It's about creating a society that supports health for everyone,
That's the goal. Health equity means everyone deserves a fair chance to be healthy.
regardless of their background or circumstances.
Precisely. And technology can play a role in this too.
How so?
Well, telehealth can improve access to care for people in remote areas.
Right.
Mobile health apps can empower people to track their health and connect with resources,
And data analytics can help identify patterns of health disparity.
allowing for more targeted interventions.
So technology can be a powerful tool for bridging gaps and promoting health equity.
Exactly. But it's not just about technology, it's about changing mindsets
Shifting from a reactive approach to health to a proactive one.
and addressing the social factors that influence health.
It's a complex challenge, but it's one we need to tackle.
It's not just a moral imperative, it's an economic one too.
Because healthier populations are more productive populations.
Exactly.
Yeah.
Investing in health equity benefits everyone.
And it's a global movement.
The World Health Organization has made it a top priority.
Countries around the world are working to create more equitable societies.
It's a collective effort to ensure everyone has a chance to live a long and healthy life.
So as we wrap up this deep dive into healthcare, one thing is clear.
What's that?
We're at a crossroads,
A time of great change and uncertainty.
but also a time of immense opportunity.
Absolutely. We have the chance to build a better healthcare system.
One that is equitable, accessible, and truly puts patients first.
It won't be easy, but it's a goal worth striving for.
So let's stay informed, stay engaged, and keep pushing to progress.
Until next time, stay curious and keep learning.